Good morning, good afternoon, and good evening, wherever you're at in this big, beautiful world we call Earth. My name is Cody, and I am the host of the Benefits 3.0 series brought to you by Behind the Premium podcast. And joining me today is my co host with the most, Jacob. How are you, my friend?
Doing great, Cody. Thanks.
Awesome. Always glad to have these Friday morning sessions with you. It's a great way to kind of break down our week, break down, everything that's happened, especially for you working on the Well Trio front. Kind of curious because you are in the thick of it. So, before we begin, anything you want to jump in and say before I set the tone for today's topic?
Nope, I'd say dive right in.
All right, perfect. So the big thing is that if you've been in the healthcare industry for a little while, you're beginning to see some of the pages of the healthcare playbook unfold. And some of those things are more apps, more clinics, more portals, more things that tend to be on the post claim side of things. And, you know, there's the real reason why your healthcare costs keep going up and your premiums keep going up as well. And my thing is like I feel like we're almost confusing access and convenience with engagement. And that's the real reason why some of your costs in the healthcare space are continuously going up while we're sitting around scratching our head. But what if the true problem was never really about the access and the convenience? What if the problem was not even the unused benefits either? What if it was how we use our brains as humans when it comes to our own personal health? And that's what Jacob and I are going to be somewhat going down the rabbit hole of today is what's going to be the next big thing in healthcare that's going to basically correct some of the course actions that we're on right now or even break it to the point where it can start getting fixed. And I'm not talking about another app. I'm not talking about another portal. And I'm definitely not talking about an advanced AI 24/7 support bot. What I'm talking about is a proactive, relationship driven model that meets employees where they are before the claim, before the crisis, and definitely before they make any costly healthcare decisions. So, again, this is Benefits 3.0, and today we're going to be talking about the future of embedded clinic teams. So, you want to kind of tell us, Jacob, a little bit about what that
Sure.
means and what that looks like?
So I think when people hear embedded clinic team or clinical team, they think on-site clinic. And that's not what we're talking about because there is some value to an on-site clinic, but there's an on-site clinic still requires the employee to take the initiative and go. And it provides an option for the employee to use the on-site clinic or go to their primary care or go to the ER. That clinician on site isn't doing the proactive activities that actually change behavior. They are providing, more of a discount. I don't want to say discounted service, but they are providing a lower cost service. And the so that's not what we're talking about. Is that clinical services? That's nice, and that's a piece of it. What we're talking about is a dedicated team that is proactive, like you said. They're reaching out to employees, they're engaging pre-claim, they're learning about the employees' lives and influencing their behaviors from a health standpoint, from a health benefit standpoint, from a care navigation standpoint, patient advocacy. So they're trying to steer and educate behavior before it's up to the employee with like a lot of these other programs. So that's what that means to me.
Yeah, that makes sense. And I think this is a great segue into where I kind of want to go with this first question. And I think one of the big things that a lot of us set aside the healthcare industry, I think in general, we get into almost an illusion of access to things, right? And it doesn't matter if you have an app that helps you with your nutrition, or if you have an app to help you with care navigation, or even if you have an app that helps you watch over a million different titles of movies, right? It doesn't matter. It's all about that perception of access, right? And I feel like, there was a term floating around a few years called subscription fatigue, right? And I feel like a lot of us do get into that kind of mentality of like, hey, this is great. This new shiny thing is going to help me solve all my problems. But there's one major problem with that, at least in my mind. Correct me if I'm wrong here, but uh, that still requires the human input in order to get something out, right? So if it's that movie app that I want to see, I type in the title or it suggests something, but I still need to interact with it. I need to open it. I need to go. So I think you're touching upon something that's really important with the keyword there, proactive. Do you want to kind of like really describe what that means when it comes to this clinical team that you're talking about?
Yeah. So the way I look at it is initiative required is a scale. And for things like apps, health apps, your streaming app, things like that, wellness programs in general, there's somewhere on that scale where those programs land.
Right.
And the more that you can shrink the required initiative from the employee side, the more engagement you're going to have. And that's how I look at it. So we're never going to get away from some initiative required. The employee still has to, for example, sign into our, a care team meeting or whatever, right? Like, but all they have to do is sign in. They don't have to like remember the app is there. They don't have to, take a lot of initiative. It's very small. Same thing when something happens, an emergency happens at home. Maybe their kid gets croup in the middle of the night. They do have to take a little bit of initiative because they've got to make the phone call to like the Welltrail care team, for example. But as much as we can reduce the initiative required, in software, we call it shift left. So shift left as much as possible. And that even in management, that's a concept, right? Like try to push decisions down, like push decisions earlier in the chain, make them smaller. And so that sort of a concept, I think, applied to embedded clinical teams, I think is kind of the future, right? So like how much can that team take the initiative and take it off of the employee and kind of work proactively like that to change behaviors?
Yeah, I like that. I like that. And I think if we even go a little bit deeper on that as well, if we look at the cognitive behavior of humans, it's really interesting because when we need help, we'll take every effort and every step to get help or to solve our issue or our problem that we're facing at the moment. But I guess the real cost and the real issues are when we're fine, when
you think you're fine,
when we think we're fine, when we think we're good, we're busy, we push it off. I mean, that's where a lot of the one of the largest gaps in every single benefits plan out there is preventative care deferment and avoidant type of mentality, because it's like, oh, geez, I'm slammed with this project at work. I got to go pick up my kids from soccer practice. I got to do this. I got to do that. I'm just going to cancel my annual checkup. Right.
I would maybe. I mean, I think a lot of people, based on what I've seen, the behaviors I've seen, and the data I've seen, it's not even like they're like, oh, I'm so busy, I'm going to cancel that. It's like they don't even schedule it. It's not even like they have to cancel it. They just never schedule it. You know how many health issues start with metabolic health?
Oh, tons.
It's like 90%.
Yeah.
Of any health issue somewhere, don't quote me, I'm not a doctor, somewhere around 90%.
Too late. I heard he tweeted it.
Somewhere like 90% of health issues start with metabolic health. Do you know how long it takes a metabolic issue to surface? So from the time you could first detect it in some sort of early detection metabolic test until the time it presents as like a chronic issue or a symptom that requires like a doctor's visit.
No clue.
It's between 5 and 10 years.
Oh, wow.
And so if 90% of our problems, our health problems, start with metabolic health, and it takes 5 to 10 years for for that metabolic issue to surface in a symptom that you care about that causes you pain or discomfort, or I don't know, a rash, headaches, achy limbs, uh, any sort of like non-normal health issue. A lot of that starts with metabolic health. So then it sort of begs the question of like, shouldn't we try to intercept that earlier? And going back to your point about people scheduling their doctor's appointments and doctor's visits, doctors aren't even educated on a lot of like the metabolic things that Weltrio looks for. They just, there's not like a prescription you can take for some of these things, and so they're just not educated on it. There's not a lot of resources for them. We were on a podcast Wednesday, and one of the folks on there, Kevin, was talking about his metabolic testing process and just making the strong argument for getting in front of metabolic issues before they surface within your visit. And I think there's so much power there. The thing is, how do you get a population of people to do it?
Right. Right.
And I think that's the hanging question, is how do you get them to do it? How do you motivate somebody until there's pain, like you were just talking about, until there's a problem?
I feel like we've gone down a pretty good rabbit hole because there's like 3 different areas I want to go in. So I'm going to try to remember all 3. But the first one I want to really do is, you're talking about really specialized and personalized data, right? And one of the biggest problems, I'm a huge data guy. I know you are as well. I know that Weltrio is really focused on both pre-claim as well as post-claim data.
Yeah, it's a package. You need it all.
Yeah. And so how is that really working in today's healthcare system? Because let's be honest, I in the past month, I've gone to 2 different doctors and I've had to fill out the stupid form twice. It's the exact same questions. And you know what? The crazy part is they're all under the same umbrella of the doctor's office. It's just 2 different doctors and 2 different specialties. Why can't they just reuse the data? And why can't I share my data with them? And why don't I have access to the data?
Yeah, I mean, there's, I think, a simple answer and a hard answer. And the simple answer is liability. Obviously, like the doctor's office wants their own fresh set, because if they rely on somebody else's data set provided to them, even though you might have filled it out the week before, maybe something changed. And that liability is just too high. And I bet it goes, it goes back to malpractice insurance, right? There's requirements that insurance has for that. I just think that is a difficult mountain to climb.
No, I get
I
it.
think we're headed the right direction, but that's like definitely a political, like maybe even a legislative, I'm not even sure. That's a really big picture issue, I think.
Yeah.
And where Weltrio is going is like, let's walk into that doctor's appointment with a list of blood tests that need to be run. Let's give that to your doctor, because the doctor will run a fraction of those tests on their own, and adding the tests that will actually give you a lot of deep insight to your metabolic health. It doesn't cost any more to run those. It's just that the doctors don't do it. It's not the normal thing they do. And so,
Yeah.
I don't know if we can go after the filling out 100 forms every week, but I think we can go after, let's make the output of those visits more valuable.
Okay.
For the effort.
Perfect. So kind of a follow-up to that one as well. How do you think, if we, as here in the US, patients were able to have access to their information and be able to share that with their doctors, and doctors just, everything was just kind of free flowing back and forth between doctor to doctor, and very secure, HIPAA, all that kind of stuff compliant. But on the flip side of that is, if I went to you as a new doctor, I can basically tap my phone, give you permission to access my medical file type of thing, or whatnot, regardless if you're with this provider or that provider. How do you think that would really change the whole industry?
Man, I can think of a couple changes out of the gate. There's, a liability of how that data get in there. So if I'm sharing my data with my doctor, they're going to wonder who put that in there, what provider put that in. Are they, properly licensed? Do they actually know what they're doing? How long have they been practicing? Can I trust the data that's in there? That would be my first thought as a doctor. But that's we got to deal with that. I think we got to fix that. But I think the bigger benefit outweighs that. I think the benefit of um, having your, I don't want to say fleet of doctors, but your caregivers, your group of providers working together, where there's kind of one pane of glass for all your medications and your treatments and your diagnoses and your health issues and your blood work and all the labs and testing and imaging, and if all that can be collected into one pane of glass, and then if you can trust it from like a provider standpoint, I think that's fantastic, because now you're enabling different types of conversations. um, I look at examples for myself where I've gone to like a specialist and they want my medical history. Well, I fill out the same form again. But maybe I forgot something, important that happened a year ago, right? And maybe it's relevant, but I don't know it's relevant, and I forgot that it happened. I forgot a medication I took a year ago, or, I don't know, whatever the thing is. Maybe it doesn't have my full blood work, and that matters for the prescription they want to write. Maybe you're allergic to eggs, and eggs are in a lot of medications. So, hopefully you remember to tell your doctor that, but what if you don't? I think it would be really great. It would streamline a lot of care if you had one pane of glass. And to take that a step further, I think something like that is going to be critical in like a benefits 3.0 world, because I think employers pretty soon are going to be done paying this incredibly broken system. They're going to be done dumping money into it, right? So they're going to get creative with how do they reduce their costs for healthcare. I think one of those ways is that proactive care team, proactive clinical services, a little bit like a direct-to-consumer model of healthcare, right? Where you can still offer your plan and be compliant with whatever regulations, but then you're optimizing that plan by getting care directly to your employees. And that care is, like we were just talking about, getting in front of metabolic issues, getting in front of chronic issues, treating those and dealing with those early, so that it doesn't escalate into a big cost that hits your insurance and hits your premium. There's a lot of conversation points around that, but I think having a single pane of glass will make that whole process a lot more efficient. I think as soon as companies realize they can not play by the BUCA rules, I think it's going to be a game changer.
Oh, 100%, 100%. So that's vein one of this deep dive. We're going to kind of pull it back. You talked about a couple of, touched upon the other two. The first one is the metabolic, right? That's a really fancy term that's I'm seeing thrown out there quite a bit. A lot of people use it. Some people don't. It's new to people. It's old to people. And what is that exactly? And why and how is WellTrio using that kind of data? Plus, I believe you guys do like DNA testing as well. How does all that work in with what WellTrio is doing on the proactive side?
Yeah, boy, we're there. This is like a deep pond that we can dive into. So
we can go as deep as you want, my friend.
I don't know how deep I can. So I'm not a doctor, right? But there's a lot of stuff I've seen, and I think we've all seen, where you get blood work back and it says your kidneys aren't working, your pancreas. Let's go with the diabetes example. Your pancreas numbers are a little low. Well, if the doctor sees that, but it doesn't hit a threshold of prescribing type 2 diabetes medication, they basically ignore it. Right. And it's not a fault of the doctor, right? This is their education. This is how the system output doctors. If you work with often naturopaths, or a clinical team that doesn't approach those tests in a traditional way, they look at a broader spectrum, and they put a lot of pieces together, and they look at your health and your labs as kind of a puzzle that they're trying to put together. And when you put that whole puzzle together, instead of having the 5, 10, 15 pieces spread out here and there, when you get the whole puzzle together, you see the picture.
Yeah.
And that's so powerful when you start thinking about things like kidney disease. You start thinking about things like gout. You start thinking about Alzheimer's. You start thinking about breast cancer. A lot of these are almost completely preventable through metabolic health, nutrition, diet, lifestyle. Again, not a doctor. Don't stop taking your medication and start eating vegetables and saying, "Wow, behind the premium side, I could."
And I'll be healthy. I'm good to go.
You'll be healthier. So that's just kind of one example. I mean, for speaking personally, I got diagnosed with gout. I don't know, 5, 6 years ago, and it was pretty bad. I could barely walk. All my joints hurt. I didn't know what was wrong. I thought I'm just getting old, and this is what it's like to get old. And everybody says it sucks. I didn't realize it would suck this bad. Finally went to the doctor because I wasn't very educated about all of this stuff back then. And doctor said, "You've got gout. There's a couple of prescriptions we can do. Let's look at them." Well, I've always kind of been not a little bit reluctant to take prescriptions. So I said, "Well, what are the other options?" I had to push a little bit. And fortunately, I have a really good doctor, but he outlined, okay, well, let's start with a very restrictive diet, and let's start to test what your body responds to, and how do we manage this with diet and lifestyle. And we were able to do that. But it took a lot of research on my part, a lot of conversations with my doctor. I had to kind of push on it. A lot of doctors just aren't comfortable not prescribing something. And I did this because personally, I don't like taking medication.
Yeah.
Now that I've done it, it's a lot better. Yeah, I have to sacrifice a little bit in my diet, and I can't just eat whatever I want, whenever I want. But overall, it's made me healthier, even setting aside the gout. And these are the kinds of things that a lot of people just don't know. When you go to the doctor, you want to trust your provider. And when they tell you, here's the prescription, here's the treatment plan, you trust them, and you want to, and you should. But you also should know that sometimes there's a different way to approach some of these problems. And not that the doctor is wrong, but let's talk about, how could we have gotten in front of this 5 years ago, right? So how can we stop the issue before it escalates into needing $1,000 a month prescription?
Yeah.
And there's just countless examples of, I mentioned it before, the diabetes, breast cancer, Alzheimer's. There's so many different issues that can be caught early and prevented, that save money but make your life better.
And it's interesting because maybe we should change this from Benefits 3.0 to the Gout Club, because I'm right there with you. A few years ago, almost identical situation as you. I do not like to take, medications. Like when I go in for surgeries, I like to get off it as quickly as I can, but I don't like to be on other medication as long as I do. So shameless plug. Try foot zoning. You should really try it. I'm throwing it out there to all the foot zoners. This is a plug for you guys. It is a great thing because when I feel an episode or an attack come on, like a couple of days, you kind of get almost like a day or two, your feet start aching. My wife is a foot zoner, so this is why I'm a huge believer in this. I will have her go do it, and I don't have to be on a gout pill. I've been off of a gout pill for 3 years now. Similar situation. I found out about 5 years ago that I have gout, and it has been phenomenal. Again, not trying to cure anything here, but it has helped me tremendously. And this is exactly what I believe you're trying to say here, Jacob, is that there are other alternatives. There are other preventative steps that you can take, which is great. Do you mind just kind of telling us a little bit more about like the DNA side of things? Because to me, that's fascinating because I've never really understood that I understood that there's a lot of like code within your DNA, but I didn't really realize how that can affect certain things, especially when it comes to weight loss, to preventative care, to even the medications that you take on a regular basis. Because let's be honest, like there are tons of people out there that are probably taking medications that they should not be on.
Yeah, and I want to be careful with that. There's a lot of people taking medications they might not have to take, and
that's probably a better way to phrase it.
Because Welltrio is definitely not anti-meds, anti-prescription at all. We are pro-lifestyle, pro get in front of the condition early, pro nutrition management, things like that. So to speak to the DNA, it's very, very fascinating, and we have experts on our team that know a lot more about it than I do, so I can scratch the surface. But have you ever used Ancestry.com or something like that?
Yeah.
23andMe.
Yep.
And so you get, as part of their app, you get this your predisposition to sort of list of traits. I don't know if you've seen that. So, for example, I'm predispositioned to not take a nap. I'm predispositioned to wake up early.
That sounds horrible.
Yeah, I think it sounds great. But that, it's pretty wild what they can tell from just your DNA. And what you're likely, it's all kind of statistics, but what are you likely to enjoy more? I'm not much of a talker. It's sitting here on a podcast, a little evidence to the contrary, but
baby steps. We got to start somewhere, right?
Yeah. I get done with a day full of meetings. I'll have 3-4 hours of meetings and just be completely fried. I'm done talking. That's in my DNA. That's actually I don't say a symptom because that sounds horrible.
It's a personal characteristic. Yeah.
And so 23andMe and Ancestry.com do this for things that are interesting to you as a person, right? Like lifestyle related things. Well, aside from that, there's the same sort of data available for health issues. What are you predispositioned to? Again, diabetes, gout, different cancers. They can even get down into specific types of cancer that you're predispositioned to. They can get into kidney function, liver function, all these things that really, really affect your overall health. But 5 to 10 years from when the problem starts from a metabolic standpoint. And so a DNA test interpreted by people who know what they're doing can tell you so much information about what you can do now to make yourself healthier later. And I think it's so powerful. And I'm frankly amazed at the interesting things we can pull out of DNA and the guidance we can give, based on that data.
Yeah, and I think it's kind of important in about what you guys are doing at Welltrio. And I don't think you brought up a good point. You're not anti this, you're not anti that. What you're really about, and correct me if I'm wrong here, but what you guys are really about is behavioral change. Because I think a lot of us, I'm just like everybody else. I like my sweets, I like my soda, I like things like that, but they are setting me up long term to potentially have health issues down the road. And I take one pill and then I have to take another pill to counteract some of those symptoms. And I think that we can easily, as humans and as American citizens, can get into a spiral effect with our health if we're not careful. And I think that there's a good blend of us out there that are like that are in this spiral effect. But then there's others that are very conscious about their health. They understand their body. And I think that that's kind of Welltrio's kind of main mission and vision is to kind of change the behavioral health of each employee it works with. Is that correct?
Yeah, 100%. That's what we're trying to do is get in and affect behavioral, the decisions you make related to your healthy behaviors or unhealthy behaviors, help people understand the impact that their decisions today will have, next week, a month, a year, 5 years from now. It's actually pretty incredible. You talked about the prescription, and then you have to take another prescription to counteract the symptoms of that one. the entire healthcare system is built to keep you alive and as unhealthy as long as possible.
What? That's not true.
I think everybody kind of knows it.
Yeah.
And the tough thing is it's a system problem, not an individual problem. So doctors, for example, doctors, they don't want you to be sick, right? They're doing their best. They're legitimately doing their best. Your providers, all the people around you, all as part of the system, want you to be healthy. They want you to move in this right direction. But then you take a step up from the providers and the boots on the ground kind of people, and you get into the systematic issues of who makes money on prescriptions, and do those people that make money on prescriptions, do they influence the health guidance that comes through like the federal government, the CDC and the Diabetes Association, all these things, the guidance of diet, the guidance of lifestyle. And you start looking at some of these things, and that's a crazy rabbit hole because there's a lot of conflict of interest, at that upper level. And so you start looking at how the system is built to sort of make money at that higher level, and it's pretty wild. I think it's sort of gross, like how that the sick care system, is kind of all over. If you start digging into this, one of the things WellTrio is trying to push is to help employers understand you don't have to play by those rules. You really don't. Those rules make other people money. You don't have to play by those rules. Change the game, and you can change the game, and it works, and it's absolutely incredible. We actually don't advertise best case scenario for our clients because nobody believes how much money we save them, how much retention and recruiting improve, how much happier people are. We actually don't even advertise or market a lot of those best case scenarios because people don't believe it until they get into the system and they start to see it work. So it's just an example of how employers can take that reality and change it. And they're changing it to kind of bring this full circle. Individuals can change their reality. You don't have to be stuck in taking all these medications, that half of them are just counteracting some side effect of another medication. Start having conversations about, okay, how do I change my lifestyle so I actually don't need these medications? Start working with your primary care provider. Start asking questions.
And these are things that WellTrio's health advocate coach that gets assigned to them, as well as their assigned board certified nurse, that team that you guys assign to each employee. These are questions that they can pose to their team, right?
Yeah, and so we call that a care team. It's a board certified coach and a board certified nurse. And that's the care team, and you're assigned a care team. So you have your dedicated person. You have their phone number, and that's who you talk to, and they know you, and they know your kids and your dog or your cat or whatever. And so they know how you live, they know your lifestyle. And the way WellTrio works, more shameless plugs, I think this is the fourth or fifth one. Oh, well.
Well, you're sponsoring this episode, so I mean, you can chill all you want, my friend.
So the way WellTrio works is that we don't come in and say, you need to change this or that. We come in and we say, hey, John, Mark, Lisa, whatever, is there anything you want to improve? Is there anything you're not happy with or that you think could be better related to your health or your life? And that's where it starts, because going back to the motivation for change, it's got to start internally, right? And so that's one pretty cool thing about our program. It's not, we don't come in and say, cut back on, the bacon or the Oreos. Sure, if you ask us, we'll tell you to cut back. But we come in and we say, you're not happy being out of breath when you get to the top of the stairs. Well, let's figure out what we can do about that. You're not happy that it's hard for you to pick up your baby, right? That, your back hurts by the end of the day. Well, what can we do about that? so it's real practical things that we can connect to lifestyle, diet changes and things like that. You get headaches in the mornings. You wake up with a headache every day. Let's dig into that. That's not normal. Let's figure out what we can do rather than popping, some pills, some ibuprofen or a prescription. Maybe there's changes that you can make that will make your life better, improve your metabolic health, reduce the risk of future chronic issues, and make you healthier and happier.
It's almost like telling people that are completely out of shape, right? Just walk from here to the mailbox, walk from here to the end of the street, walk from here, a block or two. And then over time, that repeated pattern it's like a domino effect, right? It gets people, oh man, now I want to run in a 5K. Now I want to try to take up cycling or swimming or, some other leisure activity because it's those small little wins that builds their confidence or their self-efficacy, right? And so that's interesting. So would you say that Well Trio is definitely meeting the people where they are?
100%. That's our aim. That our care team meets you where you're at, because otherwise you're not going to be motivated. You're not going to connect the dots to the changes you need to make. They're not going to be personal.
Okay, I'm gonna follow up on that here in just a second.
You had another question.
I do. But before we do, I want to just finalize this last deep rabbit hole we just went down. So by meeting the people where they are, helping them with behavioral change, what does this ultimately mean for the employer?
Yeah. So that's one of the things I love about Well Trio is the economics of how it works. Because when health improves for employees and there's a whole picture there. So there's the long-term 5 to 10 year sort of metabolic impact. There's the short term of what prescriptions are you on and where can we source them from? What are the absenteeism rates for your employee population? What's the ER visit rates? A lot of those can be managed and controlled before the cost hits the claim list. And so what it means to the employers, and again, we don't advertise this a ton, but I mean 70+% reduction in healthcare costs.
Wait, what did you say?
We've seen 70+% reduction in healthcare costs through our program. Employers don't believe it. They don't believe it can happen. We've seen it. There's such a huge impact to the bottom line for healthcare. I preach this all the time. Healthcare is your number 2 or number 3 expense in your company. As an executive or a business owner, if you aren't dialed into that, you're throwing money away. You need to get into the weeds of your healthcare program and figure out what's going on and look at solutions. And on top of that, you've got a fiduciary responsibility. ERISA states that. According to ERISA, the business owner, the executives have a fiduciary responsibility to make sure that those health plan dollars are being spent wisely. It's literally criminal not to.
That's crazy.
There's a huge amount of savings available. And so, but we don't even need to talk about just the dollars. Let's talk about absenteeism. Let's talk about employee loyalty. Let's talk about recruiting and retention. We just recently concluded a case study. I don't know if it's actually published yet, that demonstrates employees are making employment decisions. Job candidates are making employment decisions based on the healthcare offering. And when you have something like a dedicated health coach, a dedicated nurse, it's a huge game changer for attracting the right employees. And we all know it's a very difficult market right now. There's a lot of unemployed people. And there's a lot of effort and work going into making sure you recruit and retain the right employees for your business. And this is just a great strategic advantage from a recruiting and retention standpoint.
And Well Trio is no cost to the employee, right?
Yeah. Great question. Going back to the economics, the employer covers the cost as just part of their health expenses, but then the savings are distributed across the employee and the employer because the savings are so great. So the employee doesn't have to foot any of that cost, foot the bill for like the Well Trio program. They just get the benefits from it. And then as as time goes on, as those benefits are realized, the entire cost of healthcare comes down for the company. Everybody wins.
Wow, that's amazing. With healthcare being what the second largest expense for most employers, saving upwards to 70% of your annual spend. Oh my gosh, that could be, I could just think of all the different areas that we could spend that money uh, within an organization, right? Bonuses, pay increases, uh, more pizza parties on Friday. I'm just joking. Um,
With lots of
don't want
soda
to
and
we don't want
donuts.
to digress on all the hard work that Will Trio puts in to make your employees healthier. We let's just make that clear. But okay, so I'm going back to the gotcha question that you said earlier, that meeting people where they are has become a widely overused cliche kind of phrase in the healthcare industry. And but the reality of it is like I said at the beginning of the podcast, more apps, more portal, like medical portals, more services when it comes to post claim or even just quote unquote wellness programs. They still expect the employee to come to them, which I feel like is where this is getting overplayed. But where you guys are coming in, you've alluded to it already. You take a proactive approach to it, but with a clinical team, can you explain how that it works just a little bit more so that you're meeting the employee not just when they need support, but you're also there emotionally, psychologically, and also geographically, because I think that's a big concern for a lot of people as well.
Yeah. So, speaking to the engagement rate, typical wellness programs and different things that employers do, there's on average about 8% of the employees engage with those types of programs, and it's the same 8% that engage with every program. And so, adding programs doesn't necessarily increase the impact of the program across your workforce.
Right.
And those 8% that are engaging, they're already motivated to do other things, separately or on their own, that are healthy, good, improving their cost basis. Trio differentiates by being proactive, and kind of going back to your question here. The way we're proactive is reaching out at least quarterly to talk to every employee. So we talk to every single person at least quarterly, talking about how they're doing, talking about what's going on, these health goals. What do you want to accomplish? What aren't you happy with? And starting to structure some of those types of processes, and pulling out that sort of internal motivation that every individual has for getting better. You want to feel good. You want to feel better. So we pull those out at least quarterly, but it's at least quarterly. So there's a number of employees or a number of members that maybe a monthly engagement makes more sense, or weekly, and it depends on the situation. So we're able to build those relationships, understand their sort of lifestyle, understand what their goals are, help them achieve those goals. And there's a whole range. And we could go down all these examples.
And Well Trio works with a variety of different plan payment structure type, right? By what I mean by that is fully funded, level funded, self-funded. And I correct me if I'm wrong, but with self-funded, that's where you guys really shine, because to your point, you could even have a touch point without the employee even really knowing, because you get put into the approval process of, claims being paid, things like that, so that if there are situations like, what's a good one? I ate too much ice cream and I feel like I'm going to explode. I go to the ER, which I could have just visited a telehealth and saved myself $5,000 or whatever.
Yeah.
Right? Is that correct?
Yeah. So there's so many examples. So, and paths this could go down, but one example I really like is, if you have kids, they've probably gotten croup, And I've used this example a lot because I think it resonates and a lot of parents can really, connect with it.
Mm-hmm.
When you have a kid, they probably get croup. When they get that barky, scary cough and it seems like they're having trouble breathing and you don't know what's wrong, inevitably it's 2 o'clock in the morning. And, so you're waking up out of a dead sleep. It seems like your kid can't breathe, and they're a baby usually, 1, 2 years old,
Mm-hmm.
although it obviously can extend older. And you're kind of panicking, right? And so you either call an ambulance or you take them to the ER, unless you know a better way to deal with it.
Yeah.
And a better way is, if you've had this before, that cold air almost instantly clears the airway, right? So hold them in front of the freezer or take the baby outside, if it's chilly out, and almost instantly they're fine.
Yeah.
And it's sort of like magic. You're still panicky because you don't know what happened or what's wrong, and so you take them to the ER, and now there's a $3, $4, $5,000 pediatric ER visit. Well, with Weltrio, one of the key differences is we know you have kids, we know you have young kids, or we know you're pregnant. So we get in front of a lot of these issues through education. And so we start the education process before the point of impact. And I think that's a key solution towards like breaking the system, right? Not playing by the rules. The rules say go to the ER when you've got a breathing problem.
Right.
Yes. Or understand why the problem is there and understand there's 1 or 2 things you can do that take a few seconds that solve the problem. I'm not advocating for if your baby can't breathe, just take him outside and wait. I am advocating for education on why some of these things happen and what you can do about it and what to look for. And that's what our nurses and our care teams do. If you're in that moment, you call our nurse, they go through a triage on the phone and they ask questions. Is there a fever? Is there a texture? Is there a rash? A poke here. Does it seem like it hurts? I don't know what they all are, but there's a whole triage, right?
Yeah.
And so we give peace of mind in the situation. We take panic out, and we help solve the problem in an efficient way through that.
I like that. And one thing that I've kind of picked up on, kind of conversing with you and your team is you guys really focus on trust, right? And with a lot of advanced AI support bots, chat bots, whatever, some of these brokers or HR benefit and admins are kind of putting together and part of their benefits packages. That's one thing that the AI cannot replicate is the trust level, and they can't really show empathy. They can't really show when you're in the moment. So like you said, I think any young parent or any older parent that has had kids has gone through the croup thing. So I think that's a great story. And I think that that's something that with a lot of these coaches can empathize with is, what the person is going through at the time. And so, when my question is, AI is definitely taking on a new role within the healthcare industry. And we can go down, again, so many different rabbit holes on that one, but specifically in regards to trust with the employee, when do you feel like AI stops and a human in the loop or the human transition comes into play? Can they both dynamically work together? Does that make sense, or does it need to be a full one-on-one relationship with the employee?
Yeah, so I think there's a lot of layers to the answer to that question. I don't think there's a one size fits all when you start getting into a lot of scenarios. So I'll start with, Jensen Huang says, and there's a lot of stuff he says I don't agree with, but there's some stuff he says I do really agree with. AI is great for tasks. It'll replace tasks. It doesn't replace jobs. And I think that speaks to the sort of broader concept of AI is a very useful tool, but it is a tool.
Mm-hmm.
And so you need different tools in order to get things done, to execute a strategy. And so I think from like a strictly business standpoint, I think there is a path where AI enables a lot of productivity and a lot of rapid movement, fast movement in terms of the business. In terms of the personal relationships, I think it's a mistake to trust AI implicitly. And I think we've seen there's horror stories in the news, right? You could go look them up. I don't want to talk about them. There's horror stories about trusting AI too much.
Yeah.
And so because people replace this concept of like tool and job, or maybe you could say tool and advisor, or tool and partner. AI is the tool. It's not these other things. It's not the partner. It's not the advisor. It can give advice, but you still got to filter if that advice is good or applicable. And so the vision for WellTrio and the way we enable our clinical services is human first. It's AI enabled, human first, because think about for yourself, like the situations you've been in, you've mentioned a few in the past. Do you want to talk to a machine about it, or do you want to talk to a person? Right?
Yeah.
You want to talk to a person. That people are relationship based. People crave relationship. That's innate in human nature.
Well, it's built into our DNA. Going back to the DNA thing, right? It's a characteristic code within our DNA to connect with people. It's crazy how that works, right?
So we're wired that way. We're built that way. Let's not fight it.
Yeah.
Right? Like, let's enable better results through capturing the way we're already built. Let's use AI to support that. Let's use AI to find, help us find different medication. Let's use AI to interpret your DNA. Let's use AI to answer questions. It's a tool, and there's a lot of really, really incredible things it can do as a tool. But let's not confuse tool and advisor or tool and partner.
Yeah, and I think that's a great way to look at it. I came across an AI software that claims to cut waste out of your plan.
And I'm sure it can.
I'm sure it can too. But to your point, where there's a tool versus human interaction, I think that's important because, at the end of the day, just think about like an app or a subscription that you signed up for. A great analogy that I love to use all the time is when you sign up to get that 10% off discount and you put in your email, and then they bombard you all the time with offer type of thing. And I don't know about you, but like for me, I always just like unsubscribe. I just don't want to hear it, right? And so for me, when I was looking at this software, I'm like thinking, oh, okay, great. This is, to your point, a tool. But if the business owner, HR team is dependent on this doing the proactive engagement with the employee, I feel like it's going to be one of those things that people delete off their phone, they unsubscribe, they just don't want to hear it because the AI is programmed to be like, did you do your checkup? Did you do your blood work? Did you do this? Did you do that? Did you do? And last thing is when I'm at work and I've got a deadline and I'm already in the 11th hour, I don't want to have a pop-up of like, hey, did you do this today? No, I didn't. I don't have time for it, right? And I think that's kind of what you're talking about, right? But with a human interaction, they can kind of see like, oh, you know what? Cody is busy. We had this conversation. We converse with each other. I understand that he's in the 11th hour of his project deadline. I'll reach back out tomorrow when it's a little bit more convenient, right? And I think that that's something that AI can't recognize, right?
Yeah, you're touching on, there's the concept of like AI is really good at pattern identification. It's really good at learning from past, information and patterns, but it doesn't have judgment. So the example that I just read, I it was this morning, might have been yesterday. If you're blind, imagine you're blind, standing at a city crosswalk. You can't see cars that are coming. Do Do you want to trust a dog to tell you when it's time to go in what direction, or do you want to trust an app that says turn left, start walking? You want to trust the dog. Why? Dogs have judgment. AI doesn't have judgment, at least not yet. So that judgment, I think, is a key piece of differentiating like the task versus the the partner, the judgment. And the other example I like to use that's a little more clear is, have you ever used a chatbot on a website to ask a question, solve a problem?
Yes, hate it.
Yeah. So when have you had success with a chatbot?
When I type in representative.
Yeah. So one step higher than that, when you ask it to do a specific thing, I want to talk to a representative. Great. Let me connect you. I need the customer service phone number. I need the return mailing address. These kinds of things. If you say, my account's not loading, or, I paid for this feature, but it's not in my account, it sort of crashes. Like it'll keep talking to you, but obviously it has no idea what it's doing. It doesn't know how to solve the problem. It's got no judgment. And so maybe they'll get better. I'm sure. Well, they'll definitely get better. I don't know if they'll get to the point where people are happy with them, but it's the same sort of thing that if you already know what's wrong with you and how to solve the problem, great. AI is a great tool, right? It's even a great tool for telling you what it thinks is wrong with you, but it doesn't have context and judgment, right? That what happens if, going back to the blind scenario, what happens if you take a step in the wrong direction from this intersection because the app said go and you went, and the AI made a mistake? What happens? You get hit by a car. What happens to the AI? They say, oops, sorry, great point.
I'll take that into consideration.
Yeah, right. Like these ridiculous sometimes responses that it gives, like, you were wrong, and I spent 3 months in the hospital because you told me to walk when I shouldn't have. Fantastic point. Let me recreate, very good for you being strong enough, to power through this.
Oops, my bad.
Rephrase my answer. There's no penalty for the AI, right? Yep. There's no downside for the AI. It doesn't understand consequences. What happens, the dog does, right? If the dog takes you in the wrong direction, they're intrinsically motivated to not get hit by a car. They don't want to get hurt, and they understand that. But they also don't want you to get hurt because you are their person. You are who they care about, and they have this judgment that AI doesn't have. So AI will come a long way. We've come a long way in the past couple of years, and it's going to go farther. But I mean, for now and the immediate future, there's a huge difference in talking through your problem with someone who has judgment and understands your situation, and talking to a task-based tool.
Yeah. And, you and I have had conversations like this in the past about, these smart devices and AI are as only good as the people that program them and the data that they have to run off of, right? So you look at like Tesla, for an example, the Tesla cars, they have cameras that are 360 degrees, constantly running data, processing it, all that kind of stuff. And to your point, Tesla would be a lot better to cross the street with if a dog's not available, because it can see it in real time, right? And I think that's a good analogy of like real time versus pre or post claim, right? The app that you're talking about to tell it to walk doesn't know traffic, doesn't know the elements in the environment. It's just going off of like direction map, Google Map type of thing, right? And I think that's an interesting concept, which we'll save for a totally different conversation. But kind of reeling it back, when it comes to engagement, a lot of people in the healthcare industry, and especially in the benefits world, still treat health engagement as more like a campaign, like a marketing campaign, right? Emails, flyers, lunch and learns. I mean, you could probably add a couple more to my list as well. So how is WellTrio redefining that term health engagement when it comes to your embedded clinical teams? When they broadcast out, they reach out proactively, compared to how some of these other engagement campaigns work.
Yeah, I mean, I think it comes back to that initiative curve and we want to take as much initiative required away from the employee. And so Welltrio wants to reach out, make the phone call, connect proactively, leave as little as possible in that required initiative bucket for the employee to have to do. And we just see a ton of success there.
And I can kind of see, from what I know about Welltrio, is just like, for me, when I look at it and I think of the health engagement, to me, it's more than like you just said, it's more than like the care navigation. It encumbers education, and it encumbers the 24/7 medical support. Like it wraps a whole bunch of these different things into one thing, rather than just focusing on one specific thing like care navigation. Would you agree with that?
100%. And there's so much underneath each of those mountains that you just mentioned that affect overall success in the program.
Yeah. So let's kind of shift things. This is not a new concept, but it is a growing kind of trend where a lot of the healthcare industry is looking pre-claim and how they can support it. It is a massive amount of support, manpower, dedication to be able to have that one-on-one kind of narrative. What, as embedded clinical teams, as you're putting it, start becoming the standard, how do you think brokers will stop? Do you think brokers will stop becoming policy sellers, and HR stop being plan administrators, and carriers stop being risk pools, so that we can focus more on the employee and then building plans, building policies, building what carriers provide around the consensus, instead of going from the top down, we go bottom up? Does that make sense to you?
Yeah, I think the system overall is going to take a while to change. There already are a lot of good brokers out there that are looking for solutions. They're not just saying, here's your several policies, pick two, whatever, pick three. There's a lot of brokers that are really great, that are doing a good job to try to provide solutions. I think there's a lot of changes that have to happen at each level. I think HR needs to get out of their comfort zone a little bit and realize that there are other options out there that are actually better for employees. It's not just a cost savings decision. It's what's actually better for their people. There's executives that will need to engage the plan a lot more and engage these healthcare decisions, understand where the dollars are going and why. At every level, there's going to be some changes that need to be made. And I think, to your point, the broker, the HR, the executive, these are kind of the roles that are closest to the individual. So these are the roles that are, rubber meets the road here. They're the ones that actually talk to the employees. They're the ones that are dealing with this hands-on. And so I can see a lot of opportunity for change in those spaces. When you start getting higher level into like the policy level, we don't play there.
Mm-hmm.
There are a lot of people doing a lot of great work there. But we're really trying to focus on where the rubber meets the road. And I think there are meaningful changes that can be made and will be made.
Perfect. I have one last question, but before I ask it, do you have anything you want to kind of talk about and throw out there to this conversation?
Oh man, no, we've covered a lot of territory.
We definitely have covered a lot of different territory. So my last question for you is just like, all of us in the healthcare industry understand it, and even employees that aren't in the healthcare industry understand that the healthcare system is broken. The people inside of the industry talk about, the financial cost of this broken system, right? But one thing that we don't really talk about a lot of times, and I'm curious your take on this, what about the human cost, right? And I'm talking about burnout. I'm talking about delayed diagnosis, the anxiety of an outstanding medical bill type of thing. How does that toll change the conversations that Welltrio clinical teams have when they engage with the employees?
Yeah, that's a tough question to answer because everybody carries stress differently, has different stresses. It's very individual sort of a conversation. So there's a number of ways we see that represented. Um, stress is actually a big, it's not chronic, but it's a big cause of a lot of other problems and symptoms. So we can actually kind of approach that clinically and address the stress as well. But I mean, employers see it in absenteeism, productivity, things like that are probably the biggest ways that it shows up that I've seen. Absenteeism for, I'm thinking of several examples. I don't want to say names or anything like that, but where employees can't get themselves out of bed to get to work. They just can't.
Yeah.
And it's not like a formal depression. It's not a diagnosable sort of a thing, but they're stressed. Maybe their parents aren't doing well from a health standpoint, and so they've been losing a little bit of sleep, and so now they're tired and a little bit anxious and stressed, and so now they're having arguments with their spouse, and so that adds a whole nother level of anxiety, and it starts to feel overwhelming because now you're not maybe engaging with your family the way you want to be, and that, but what do you do about it? And it sort of starts to snowball. And I mean, I've seen it. We probably all have seen it where people just sometimes can't get out of bed.
Yeah.
Sometimes they can't function, or they turn to alcohol, or they turn to substance to like sort of start to try to feel a little bit normal or something. Yeah. So there's a whole lot of like secondary symptoms from stress, and medical bills are such a huge cause of a lot of stress. I don't have the stats in front of me, but it's when you've got medical bills, I mean, they get expensive fast, and you often don't understand them. What does this test mean? I've got 3 pages of line items of expensive things totaling $100,000 or $500,000, and what do I do about it? How do I pay it? What's my insurance going to cover? Is there mistakes? Is it duplicated? Why do I have 9 different providers? Because I've got the hospital bill, the doctors in some different organizations, so they send a bill. The anesthesiologist is different. The nurse is different. The equipment maybe even comes from a different place. You start to get all these bills, and it gets overwhelming. It's a huge point of stress. I don't even know if I answered your question, but there's a lot of stress around medical bills, and so, man, it's just having somebody to call and talk to about that, and have somebody on a team that understands medical billing that can explain it and go through it and say, okay, this
or even handle it, right?
Help you handle it. Yeah, be on the phone with you when you call these providers, work out payment plans. Long before that, hopefully your plan is already structured in a way that is supporting you as the employee in the right way. And so when stuff like this happens, it's not just all on you.
Yeah.
There's so many different ways that medical issues cause stress, and there's so many different ways that stress is manifest in employees. Almost every single one of those ways is detrimental to a productive environment for the employer and the employee. That personal engagement with life.
Yeah, I love that. And it is definitely something. Burnout is a big thing right now. It seems like with the cost of everything, people are definitely pushing it. So anyways, we are definitely over time, but we had some good rabbit holes. I have to admit, we had some really good rabbit holes here. So I want to thank Jacob for joining me today, my co-host, every Friday at 10:30 a.m. Mountain Standard Time. We dive into some of the hot topics for the week, some things that we discovered as we are both in the healthcare industry, just trying to push the status quo and find out the thought leaderships and things that we can do to help lower costs overall. So with that being said, you want to say anything before we sign off? You sponsored, so you can do another shameless plug if you want.
I think I have enough shameless plugs today. So nope, nothing else.
No, sounds good. So tune in next week as we'll be here same time as usual. And until then, we will talk to you later. Have a good one. Bye-bye.